please.
Thank you, Mr. Chairman. How about now? Okay, very good. Thank you. Thank you. Thank you, Mr. Chairman. The United States is in the midst of an opioid overdose epidemic. Sadly, 91 Americans die every day due to opioid overdoses. Nearly half of all opioid overdose deaths involved a prescription opioid. In 2010, in response to the opioid crisis and Florida's pill mill problem, Florida's legislature enacted statewide tracking of painkiller prescriptions, coupled with law enforcement using drug trafficking laws to prosecute providers caught over-prescribing. Within 3 years, Florida saw a decrease of more than 20% in overdose deaths. Despite this positive trend, opioid abuse continues to plague my district. In fact, my district had the second highest prescription drug death rate in Florida in 2014. In response, I worked last Congress to ensure that Pasco County was included as a high-intensity drug trafficking area, enabling law enforcement to receive additional resources to combat the spread of drug-related crime. I want to applaud the committee for including my bills, the Medicare Patient Safety and Drug Abuse Prevention Act and the Promise Act in CARE, which passed last Congress. The Medicare Patient Safety and Drug Abuse Prevention Act created a pharmacy and physician lock-in program within the Medicare Advantage and Medicare Part D, giving CMS the tools to crack down on this abuse in the Medicare program. And it's important for us to maintain oversight, of course, as you know, on this program as CMS is developing the rules. The Promise Act will increase safety for opioid therapy and pain management by requiring the VA and DOD to update their clinical practice guidelines for managing of opioid therapy for chronic pain, requiring the VA opioid prescribers to have the enhanced pain management and safe opioid prescribing education and training, and encourage the VA to increase information sharing with state licensing boards. I think that's critical. As part of the 21st Century Cures Act, Florida has received over $27 million in grants to help fight the opioid epidemic by increasing access to treatment and recovery services, strengthening public health surveillance, and improving pain management practices. These critical funds are supporting Florida's all-hands-on-deck approach across the state to curb opioid abuse and save lives. I'm pleased the administration and this committee are leading the charge on this critical issue, and I look forward to working together to help save lives and prevent addiction. I yield back, Mr. Chairman. Thank you.
Gentleman yields back.